Benny?
Yes, sir.
We're live. Let's go.
Good day and welcome to the virtual pressure of the results of the NCR COVID-19 panel survey. I am Etienne Bilipay of the Government Relations Unit of PUBLiCUS Asia, and I would be the moderator for today. Let me introduce to everyone the members of the PUBLiCUS Asia team. We're joined today by the COO and acting CEO of PUBLiCUS Asia, Ms. Lilibet Amaton, and the Executive Director, Mr. Aureli Sinsua. To give a background of what we do at PUBLiCUS Asia, I now turn over the screen to Ms. Lilibet Amaton. Ms. Bet?
Mike,
PUBLiCUS
unmute.
Virtual Presser, powered by VOX Opinion Research in partnership with Singapore-based Lightspeed Research, to share with you the results of the non-commissioned NCR COVID-19 online panel survey. Competitive intelligence is one of PUBLiCUS' 5 core competencies. The other 4 being lobbying or government relations, campaigns management covering political, corporate, and advocacy campaigns, strategic communications, which specializes on crisis communication, and capacity building. Competitive intelligence is the collection and analysis of information to anticipate competitive activity, see past part disruptions, and dispassionately interpret events. In essence, it generates strategically relevant insights from research and structured analysis with the aim of minimizing decision risks and reducing uncertainty about external developments. PUBLiCUS was founded in 2003 and has always been research biased. In everything it does, it is always backed up by research. Thus, in 2005, VOX Opinion Research, PUBLiCUS research arm, was formed to conduct researches, both quantitative and qualitative researches, exclusive for its clients' use. PUBLiCUS founders are first and foremost advocates of a number of concerns. And being advocates, when we have saved some resources, we thought we should conduct and share results of surveys on pressing issues that our country may be facing. And so in the latter part of 2017 to date, PUBLiCUS has been conducting non-commissioned surveys via the Pahayag releases as part of its corporate social responsibility. This is a view with a view of making the Filipino populace become aware of these pressing current issues and events that may either pose as opportunities or threats to our nation. And with the help of our media friends, be able to reach the populace and make them understand what these issues are and how they can better prepare themselves in facing them. Today, PUBLiCUS, along with VOX Opinion Research, hopes to share with you the results of the panel survey on COVID-19 pandemic. Bits of information have been coming from everywhere that the Filipino people simply do not know where to turn to for understandable, relevant information so that they may feel more empowered and confident to face what lies ahead. Today's PUBLiCUS virtual presser hopes to give you that as it commits himself in contributing to the national effort against COVID-19 by providing actionable information which empower government officials and policymakers to implement responsive database strategies to combat this pandemic. The NCR COVID-19 survey is an independent, non-commissioned survey meant to gauge public opinion on 1, approval rating on the implementation of the Enhanced Community Quarantine or ECQ in NCR, 2, approval rating of key national and local leaders in responding to the pandemic, 3, support for existing and future measures in combating the pandemic and providing aid to constituents in need, and 4, availability of household basic necessities. So without further ado, ladies and gentlemen, Benny, please.
Thank you, Ms. Amaton. Today's virtual pressure will cover the findings of the survey conducted by PUBLiCUS Asia as mentioned by Ms. Amaton. results will determine has determined the public opinion and perception on the following key variables such as living standards, national government perceptions, and support to government anti-COVID-19 policies. To give a more extensive explanation on the results of the survey, may I call on Mr. Aurelio Sinsua to share the findings of the report. To our friends in media and viewers today, you may already send in your questions in the Viber group or comment in the Facebook live feed as Mr. Sensuat reads the report. Mr. Sensuat?
Okay, thank you, Benny, and thank you, Mambet, for that wonderful introduction to give some more information about Publicus. Before I report the results, I would just like to say a few words to contextualize our survey a bit further and to discuss its methodology. Now, the COVID-19 pandemic is perhaps the most significant global crisis humanity has faced in the 21st century. As of yesterday, more than 1.3 million cases of this disease have been confirmed in all inhabited corners of the globe, costing 75,000 people their lives. Unfortunately, the Philippines has not been spared by this ruthless pandemic. The Department of Health reported as of yesterday that there are 3,764 confirmed cases in the Philippines and 177 deaths. COVID-19 has posed an extraordinary challenge to both the national government and local government units across the country. This challenge has been especially difficult in Luzon, which is now under enhanced community quarantine until April 30, and most especially difficult in Metro Manila, the epicenter of the COVID-19 outbreak in the Philippines. As Ma'am Beth said earlier, PUBLiCUS Asia Incorporated is committed to contributing our share to the fight against COVID-19. As a political consultancy and strategic research firm, our contribution comes in the form of gathering and analyzing data to provide actionable information to government officials, policymakers, and other stakeholders, empowering them to put into action responsive and data-based strategies to combat this unpredictable pandemic. Providing actionable information on public opinion about COVID-19 is one contribution PUBLiCUS can make through our in-house strategic research arm, VOX Opinion Research. As Mambet explained earlier, we've been doing research since 2005 through VOX and independently since 2007 through our own surveys. However, with strict lockdowns in place throughout Luzon, it is highly impractical and unsafe to conduct the usual face-to-face random sampling type survey that has become the standard, or that has been the standard in the Philippine polling industry for decades. Faced with such a unique challenge, which has rendered our usual methods inoperable, PUBLiCUS has adapted a survey method we previously tested in 2017, the online panel. Although they are not commonly used in the Philippines for political surveys, online panels are an established tool of political research in the United States and other countries. In fact, a 2019 article by Scott Keeter, a senior survey advisor to the renowned Pew Research Center in the United States, noted that their American Trends panel, quote, was the main source of data for most of the center's reports on US political and social attitudes and behavior in 2018. What is an online panel? Well, it is a sample of persons who have been recruited online to complete surveys through a digital platform. Panelists receive some form of compensation or incentive from the panel provider for completing surveys. Reputable online panels are comprised of people with different backgrounds and demographic characteristics. This diversity, in turn, allows for highly customizable samples guided by specific parameters. The online panel for this survey was provided by Lightspeed Research through their Asia Pacific headquarters in Singapore. Lightspeed has been providing research panels to companies for market and social research since 1996, including the panel for PUBLiCUS's 2017 Pahayag NCR online survey. Lightspeed's pool of 100,000 potential Philippine panelists was profiled and pre-screened based on the set criteria of the survey. In this case, the criteria PUBLiCUS set was for Filipino respondents aged between 18 and 70 and residing in Metro Manila. To make our sample more representative of the actual Metro Manila population, we set specific quotas for panelists from each city, proportionate to official population data. The raw data was then sent unaltered to PUBLiCUS and was cleaned and analyzed by VOX Opinion Research. The demographic information of our panel respondents indicate a diverse and well-balanced sample in terms of age, income group, and residence, given the existing constraints of polling operations during the ECQ. As such, we are confident that the results of our survey provide a reliable snapshot of the opinion of Metro Manila citizens on COVID-19 issues using an established sampling method of the sophisticated American political polling industry. So now let's jump into the results. And if you'll see here, there's a share screen. So you'll be seeing the PowerPoint in front of you so you can follow along while I'm discussing some of the slides. So again, our sample was 1,000 Filipino respondents aged 18 to 70 and residing in Metro Manila. Let's go quickly to the panel demographics. So in terms of age, our panel was relatively young. 78.3% of them were between the ages of 18 and 39. Meanwhile, 20% of the panel were aged 40 to 59, and the remaining 1.7% are aged 60 to 70. So the respondents in our survey were primarily members of Generation Z and also millennials. Now, in terms of household size, 58% live in a typical household with 3 to 5 members. Around a third of them, 33.9%, live in larger households with 6 or more members. Only 8.1% live alone or with just one other person. In terms of average monthly income per household, more than 1/4 of the respondents, 29.5%, live in households earning 19,040 pesos per month or less. Another quarter or so, 27.6%, have household income between 19,040 pesos and 38,080 pesos. Around another third, we go up to the next brackets, 23.1% live in households earning between 38,000 and 66,640 pesos per month. The remaining 16.3% have a monthly household income of more than 66,640 pesos per month. In terms of gender, if we look at Philippine Statistics Authority's stats, our population of the Philippines is more or less well balanced at around 50% male, 50% female. We should note that our panel had a significantly higher proportion of females at 62.3%. So now let's go next to living standards and needs. These questions in our survey essentially wanted to qualify, how families are doing under the ECQ with the having to stay at home, maybe some have lost work, sources of income. So we wanted to check how our families in Metro Manila are doing during these extraordinary times. When we look at the family condition during the ECQ, basically we ask them here, how is your family doing during the ECQ? Very good, good, neither, bad, or very bad. So almost half, or 47.5%, indicated that their families were doing well, doing good, or very good during the ECQ. 37.5% of respondents said their families were doing okay, neither well nor poorly. And only 15% of respondents said the status of their families under the ECQ was bad or very bad. But it should be noted, if we look at the answers to the family condition question by income group, it should be noted that respondents from the 3 lowest income groups were the only ones among all income groups to report a higher average incident of bad or very bad conditions compared to the 15% average across all income groups, which we just discussed. Significantly, In the lowest income group, or those earning less than 9,520 pesos per month, the 25.37% of them, basically a quarter of these respondents, reported that their families were doing bad, very bad, during the ECQ. And this is the highest incidence of negative responses among all income groups. Moving on to most essential basic household necessities and supplies. Not surprisingly, when we asked respondents which supplies were most essential to their families, the vast majority of them answered food and water, followed by money and medicine. But if we look at the next slides, looking at the sufficiency of their supplies of food and water and money and medicine respectively, 29.3% of respondents reported that their household had less than 1 week's worth of medicine supply remaining. This is higher compared to the number of respondents who said their households had less than 1 week's worth of money. That was 26.5%. And only 25% said they had less than 1 week's supply left of food and water. So what we can take from that is that actually it's the supply of medicines among Metro Manila respondents that is running low the most. If we go to the next slides, which show the divergent plots on the relative strength index for the sufficiency of basic household necessity supplies. Basically, we'll see here, we put those answers in the previous questions into an index. And if you can see here that the respondents from the 3 lowest income groups, or that's making a household income, monthly income of 38,080 pesos or less, they reported on average less sufficient supplies of food and water, money and medicine compared to the average among all income groups. So basically, this means that our more underprivileged households in Metro Manila have a significantly lower supply of these basic necessities during the time of the ECQ. So we move on to the next section, perceptions of national government. Next slide, please. So in this question, we asked, what do you think is the likelihood that the national government will contain or prevent the spread of the coronavirus throughout the rest of the country? A plurality of respondents, 41.3%, said that there's only a 50-50 chance that the national government will be able to contain and prevent the spread of COVID-19 in the country. So that basically they're saying pwedeng oo, pwedeng hindi. Meanwhile, 40% of respondents answered that there was a high or very high chance that the national government would succeed in containing the pandemic. Only 18.7% had low or very low confidence in the government's ability to prevent the spread of COVID-19. Moving on to the approval of the response of President Duterte and the national government to COVID-19. The question here was, please indicate your level of approval or disapproval with the manner in which President Rodrigo Duterte and the national government are responding to the COVID-19 pandemic. Exactly 2/3 of respondents, 66.6%, approve of the manner in which President Duterte and the national government are responding to the COVID-19 pandemic. 17% neither approve nor disapprove, and 16.4% either disapprove or strongly disapprove. Overall, the response of the president and the national government to COVID-19 has a net approval of plus 50.2. Only the second and third largest income groups registered a net approval rating higher than the average of 65.36 and 56.89 net approval, respectively. Now, when we go to the next slide and we look at the one slide after that, we look at the relative strength or the divergent plot of the next slide, please. Yeah, there we go. Of the national government approval by income group. I just noticed here that the president had and the national government had positive net approval among all income groups. But interestingly enough, it was lowest among both the richest of the rich and the poorest of the poor. Respondents with a monthly household income between 104,240 pesos and 190,400 pesos registered the lowest net approval among all income groups at plus 9.09%. More than 35% actually disapproved. This was followed by the top income group, earning more than 190,400 pesos per month, although their net approval was significantly higher than the 9.09 at 33.3. And then the third lowest net approval came from the group earning less than 9,520 pesos per month per household. They had a net approval of plus 34.33. So moving on to the Department of Health and Secretary Duque, a slim majority of respondents, or 53%, approve of the Department of Health's response to COVID-19. 26% neither approve nor disapprove, while 21% disapprove. However, the leader of the Department of Health, Secretary Francisco T. Duque III, has a slightly lower approval rating. A plurality of respondents, or 39.3%, approved the response of Health Secretary Duque to COVID-19. Almost one-third, 31%, neither approve nor disapprove. And the disapproval rating of Secretary Duque is 29.7% for his response to COVID-19. Moving on to the Congress, the Senate, and House of Representatives. A plurality of respondents, 38.3%, disapprove of the response of the Senate to COVID-19. One-third, 33%, neither approve nor disapprove of their response. And only 28.7% of respondents said they approve the Senate's actions against COVID-19. Meanwhile, with the House of Representatives, respondents were divided on their perception of the House. A plurality of respondents, 37.3%, actually neither approve nor disapprove of the House's response to COVID. Their 31.7% approval rating is only slightly higher than their disapproval rate of 31%. So basically, they have just a net approval of 0.7 plus 0.7. Now, when we move to the perception of local governments, as a whole, we obviously our respondents were segmented, or there were specific quotas. All of the respondents with their various mayors and LGUs. The plurality of respondents for 43.2%. More than one-third, or 34.5%, disapprove, and 22.3% neither approve nor disapprove the performance of their mayor and city government. When we move to the next slide on the approval of mayor and local government unit per city, we would like to highlight that the mayors and city governments that registered the three highest approval ratings among their respective constituents who participated in the survey. Number one was Mayor Rex Gatchalian of Valenzuela City with 83.34% approval.
This is just slightly higher than his friend, Mayor Vico Soto of Pasig City, uh, whose approval rating was 83.05%. Maybe we could say they're even tied for first place. And Mayor Miguel Ponce III of Pateros came in third place at 80%, although we should note that the sample of Pateros in our survey was relatively low compared to the others. There were only a single-digit number of respondents from Pateros in our sample because they make up a smaller proportion of the population of Metro Manila as a whole. Now, moving on to the last part of the SET report, it's support for the anti-COVID-19 policies of the government. So we'll start with the approval of the Luzon-wide quarantine. This question was asked before the this survey was run between April 2 and April 6, we have to note. And the announcement of the extension of the ECQ only came yesterday. So that had not yet happened when we were running the survey. But in terms of approval of the Luzon-wide quarantine, an overwhelming majority of respondents, 82%, approve of the Luzon-wide extended community quarantine. And if you see on the next slide, more than 3/4, 75.5%, supported the extension of the ECQ past its original April 13 end date. But please note that this data does not show the approval of the length of the extension to April 30th, as that was decided after the run of our survey had finished. So maybe in our next surveys, we will be trying to do this weekly, we will be able to ask that and take a look at that. So going to the next slide, this is a summary of the approval of existing and proposed policies against COVID of the government. Additionally to the 2 that we asked in the previous slide, we asked about an additional 8. And respondents overwhelmingly approved of 7 of them. 97.6% of respondents approved of providing frontline medical services to people with additional pay. Next slide, please. And the next slide again. Mass testing, 94.7% of respondents approve of mass testing to identify all persons with COVID-19. 93.6% of respondents approve of providing financial support to small business owners. 93.3% support providing government-controlled transportation services under the quarantine. 84.5% approve of the distribution of relief packs to households under quarantine. 83.7% of respondents approved the distribution of cash transfers to households under quarantine. And 68.4% supported allowing the controlled return of some employees to work. Of all of the policies that we tested, the only policy which had net disapproval was the proposal to provide big businesses with financial support. 55.4% of respondents disapproved of this policy proposal, whereas only 44.6% approved. So with that, that will conclude the rundown of this presentations, and thank you for listening.
All right. Thank you, Mr. Sunsuat. At this juncture, we would be entertaining questions from our friends from the media and other questions posted on the Facebook live comment area. Okay. We have a question here, Mr. Sunsuat, that reads, on the released comprehensive Flatten the Curve report on COVID-19, how does PUBLiCUS Asia plan to follow up on this? Like you mentioned, would there be another survey generated in the future? And what would the results be transmitted of this report to national government as a resource for future action?
Actually, that's a good question, and thank you to whoever asked it. Um, this NCR COVID-19 survey is actually, this is the first run of this survey, or the inaugural run. But our plan is to actually run this once a week. So as much as possible until the crisis is over, or at least maybe until the ECQ is over, we will be running this survey once a week. So it's kind of like a tracking survey. So we can see, usually we wouldn't run a survey in 1 week intervals, but things move very quickly with COVID-19, with the coronavirus. So I think we need to provide this public opinion research on a consistent basis to inform both the national government as well as our local government unit leaders on how perceptions are of how they're doing, and maybe how they can tweak their policies to be more responsive to the people. And yes, we will definitely be providing these reports to the government, both to the national government and also to local government units.
Okay. We have another question here. Trij, would the respondents' perception on the ECQ extension affect how the national government would impose the said measure?
I think that the public opinion on the length or term of the ECQ is definitely something that is on the national government's mind, especially I think considering not only the public health aspect, but also the public order aspect. From the pronouncements of the government, in the past weeks, we've been seeing that they've been a bit worried about what could happen potentially if the ECQ ran too long. Maybe there could be some civil unrest, or and that's something that the national government obviously wants to avoid. So I think it's about finding the right balance of, of course, I think a lot of people are in agreement, both experts and the general public, based on our survey, that we really need to extend the ECQ. The question is, for how long? Will it be April 30th, or will we go past April 30th? I think the timing is good for the implementation of the mass testing starting on April 14th. So they'll have 2 weeks, 2 more weeks of ECQ at the end of April to really make the most out of the mass testing. And hopefully, that's how we can get things under control enough so that at the very least we could relax the ECQ, maybe make it a partial ECQ, or just bring it down to a community quarantine.
Well said, sir. A question comes from Facebook, the live feed. It reads, the data show that there is an overwhelming approval for the Luzon ECQ and for its extension. How does this make sense with the more than 50% of the NCR respondents being on the boundary of doing neither well nor poorly, or already doing bad or very bad?
That's a good question. And I think, first of all, we are not sure when we ask how your family is doing during the ECQ, if it's bad or very bad. Perhaps these lower income families would really have higher responses, a higher rate of bad or very bad responses to that question, even without the ECQ. Because of course, with their more limited resources, it would be more difficult for them to stockpile food and water and medicine, even on a normal day. But what more during the ECQ, right? Which is why it's so important for the national government and the local government units as well to really give the relief packs, get the social amelioration programs going, and all of those things. But I think the reason for the high approval of the ECQ and its extension, I think that the Filipinos have seen that it's worked somehow, and I think we have to see more research definitely on exactly how the curve is doing now, but at least I think the public perception has been that somehow the ECQ has been working, or at least it has been doing some part in helping contain the spread of coronavirus in the country. So yeah, that's my answer to that question.
Okay, we have another question here from our live feed from SJ Torres. Would you be able to roll this down nationwide so we get a ballpark estimate of how the government measures are handled and how they are received outside of the NCR and Luzon?
Okay. SJ, thank you for your question. I think before I answer that, I would like to also talk about why we decided NCR. Well, first of all, of course, it would be it's logistically it's a little bit easier logistically when we do NCR only, and also the run is faster because if using the online panel for a national survey, we might have to go maybe as far as 2 weeks for fieldwork. So we wanted to test it out first in NCR. And also, actually, PUBLiCUS does a lot of these regional or local surveys. If you've seen our Pahayag brand of surveys, we've done NCR a couple times, we've done Vismin, we've done Luzon. So we really specialize in these regional surveys. And also, especially since Metro Manila is, of course, the epicenter of the COVID-19 pandemic in the Philippines. The vast majority of COVID cases are here in NCR. But that being said, I definitely agree with you that it would be best, if possible, to get the pulse of the entire country, not just NCR, but the rest of Luzon, especially since they're under the ECQ, and Visayas and Mindanao, because, COVID-19, it's a global pandemic. It affects everyone, and it certainly affects everyone in the Philippines. I'm not sure if we'll be able to mount that national survey, considering the logistical and funding challenges, perhaps. But we will definitely keep that in mind. And if we will do maybe an extended run in Luzon or even a national run on the COVID-19 survey, please stay tuned to our social media accounts. We'll definitely be announcing that in due time. Thank you.
Okay. We have one more question. Data from the survey also showed the frequency of Philippine households' basic needs. Would the data serve as a good recommendation to LGUs nationwide to follow in the terms of distributing aid? Relief packs.
Actually, that's a great question. Yes, and of course, pretty much what our main goal here with this survey was to really give national and local leaders the information that they need to calibrate their COVID-19 policies and programs in a way that people need it. So I think with this data, LGUs will definitely need to act fast. All LGUs, regardless of which LGU it is, whether you have a high approval rating or low approval rating. If we remember, in terms of food and water, medicine, and in terms of food and water, money, and medicine, if we see the statistics earlier, at the very least, 1/4 or 25% of all respondents lived in households which only had a supply left for less than a week. So I think that information alone should be enough for the local governments to act, especially when it comes to food and water and medicine. Because again, the national government's social amelioration programs are primarily financial assistance, because that is what is most feasible to roll out through the DSWD, since we already have the unconditional cash transfer and the 4Ps, etc. But it is the duty of all local government units, the mayors, the vice mayors, even the barangay captains also, mga kagawad. It is their responsibility to make sure that their constituents have enough money, enough food, enough water, enough medicines, So I hope that these results will move LGUs to act as quickly as possible, because there are some people who are really suffering under the ECQ, and it's an extraordinary remedy. It's something that needs to be done to protect our public health and safety. And that means that the local government units need to step up and make sure that their people, they provide their people with the aid that they cannot get themselves right now with all the restrictions around.
Right, well said, sir. Um, we have another question from our live feed. Questions about the demographics of the survey. Um, the survey mentioned a lot the socio-economic brackets as user respondents. Now, is the sample representative of the proportion of the various brackets mentioned in the report? Since we know that the Philippines has a slightly higher, lower income class, was that taken into consideration during the study and how respondents were selected for the online survey?
Actually, that's a very good question. What we used here was the purposive sampling method, or non-probability sampling method, as opposed to the completely random sampling method. Essentially, what this means is that we only drew them from a certain target population. So as you can see here, we're not claiming that these results are accurate or representative of the entire population within a certain margin of error, plus or minus. This type of online panel survey is a bit different. And as we can see here, we are not claiming that the income brackets here, or the distribution among income groups is completely representative of the NCR population. However, we just wanted to note that there's a great variety in terms of the number of respondents that we have from different income groups. And as you can see, like for example, in our income group of 190,400 pesos per month or more, it was only 1.5% of our sample. In the second highest income bracket, it's only 3.3%. We probably could have expanded the under 9,520, or the lowest income bracket, which was only 6.7% of the sample. But we should note that in general, Class E is not also a huge demographic. It's more on the D, around the D and the C now in the Philippines. And so we can see that between the second and the fourth income brackets, the second and fourth lowest income brackets, that's where more than 70% of our respondents come from. So again, we tried to make the sample as representative as possible, both in terms of income group and in terms of especially geographical location, because we wanted to do that proportional to the populations of the actual cities. But we're not saying that this is a completely randomized sample that really sticks to those income group classifications as shown in official income data. But I'd say it's fairly representative with our existing constraints, which is of course that we can't go house to house and just choose random households right now because of the checkpoints, and I think you'd probably get stopped by the police if we were doing that.
This question is related to more on the demographics of the respondents. The data on the president's approval showed that the richest of the rich and the poorest of the poor gave the lowest net approval for the response of the president. What does that data imply? That's right.
Well, it can imply many things, and it's difficult to make a conclusion based on just the limited data that we have here. But maybe for some of the ideas, I think obviously the poorest of the poor will really suffer the most under the ECQ. And a lot of these people would be working in the informal sector, perhaps, or they're wage laborers who really have absolutely no work now. And because they're so poor, they don't have any savings. And I think there's a bit of delay in how the government has rolled out the social amelioration programs, excuse me. I think it would be not a stretch to say that many of our most underprivileged countrymen are really struggling under the ECQ, which is why, again, I think these statistics should be a wake-up call for both national and local government to really step up and do more to help our most needy fellow Filipinos. When it comes to the richest of the rich, I actually did find that interesting. I'm not really quite sure why that might be. Perhaps it might have something to do with the living restrictions under the ECQ. But actually, to be honest, when it comes to the rich of the rich, I'm not really sure why that would be. I think that would need more further research for us to look at.
One question reads from Gabriel Lacusong. Is this a case as to why we need a federal parliamentary system in the Philippines as a form of government? A centralized system, but we as an archipelagic nation, says, lagi nauunahan mabigyan ng pondo at proyekto ang NCR. Samantalang ang VISMIN, crumbs or konti na lang ang nabibigay. Yun sir, is it a reason why the Philippines should pursue its shift to a federal or parliamentary form of government?
Well, I certainly think that a shift to a federal parliamentary form of government is something that could be looked at, but I don't see how COVID-19 would help for that. Actually, in a federal system, a lot of the provision of basic necessities and services would be completely decentralized or significantly decentralized to the states, whereas the national government would not have so much mandate to help out in these extraordinary times. Of course, for example, I'll give an example. One of the issues that has been brought up is the lack of capacity of our lack of hospital capacity in general to deal with a huge spike in COVID-19 cases. And this was actually covered in our first Flatten the Curve report, which was authored by myself and Ms. Malutakia and Dr. Yap. Which is why actually Secretary Duque has been calling for the renationalization of the hospital system, precisely because it has not developed in the way that it should have when health was devolved to the local governments through the Local Government Code of 1991. And I think in general, when you're facing a crisis of this magnitude, you want a strong support, from a central national entity to make sure that everyone is really being taken care of. So again, long story short, the federal parliamentary system is interesting. I think those conversations definitely need to keep going, and PUBLiCUS has been a big part of the federalism movement also. But I don't think I see anything here in the COVID-19 example, which is particularly indicative that a shift should occur.
One more question, sir. Can the approval ratings be interpreted as sufficiency or effectiveness of government's action against COVID-19 on approval
Yes.
ratings?
Yes, that's why we were for the national governments, sorry, and for the local governments, we wanted to tie the mayors and uh, the mayors and the president to their government institutions, because we want to stress that it's an institutional it's an institutional response. It's not just the president, it's also the president and the national government. It's not just the mayor, it's also the mayor and the local government. And I do think that these results, they speak more on maybe the perception of how the constituents perceive their leader, their mayor, their local government, or the president and the national government, and how they feel the response. And I mean, we can't say that's wrong because they would know better than us, especially at the local government level. I mean, we're all related to what the president and the national government, the IATF, all of the agencies are doing to combat COVID-19. But especially when it comes to local government units, I live in Quezon City. I have no idea, except for what I see on social media, how the response is in Pasay or Malabon or um, in Pasig. So it's going back to answer the question. Sorry, I went off a bit on a tangent. Yes, I think uh, these results in the approval ratings can show, how responsive and how well that the various government officials and government actors have reacted in response to the COVID-19 pandemic so far. But again, maybe there are some officials there who are not exactly thrilled with their approval rating results there. What I can say is I must remind you that this will be a tracking survey. We will do this once a week as much as possible. There's still a lot to do. The COVID-19 pandemic will be going on for a while, and there's certainly room for improvement for all. And I think if these officials take this as a wake-up call to improve, maybe do a little more for their constituents, we can see those approval ratings go up too.
Yes, sorry. Yes, hello, sir. Okay. I was muted. Question reads, the approval rating of Metro Manila mayors exists on the extreme end of the spectrum, with Pateros mayor receiving a positive 80 net approval and Quezon City Mayor Joy Belmonte receiving negative 43 net approval. How could this be utilized by the government for future policies to improve the situation on LGUs, localities that recorded below average net approval?
Well, of course, a basic tenet in our system of government is that the president does not have control over the mayors and the local government units. He has supervision. Essentially, what that means is that when the president supervises the mayors and local government officials, he can't tell them how to do things, but he can hold them to certain standards. And I think this data could be used by the president or by the Department of Interior and local government, which has jurisdiction over the mayors, to, I think, really look a bit deeper, at least in terms of Metro Manila, on how exactly these local government units are performing and how the constituents under these local government units are doing. And if possible, actually, if they should, the national government should supplement as much as it can what is lacking from the local government unit, because no matter what the LGU is, they are all constituents of the national government. And that can come in many ways. I mean, it could be requiring compliance with standards that have been set under the IATF or the orders of the government, or it could be prioritizing aid perhaps to those to constituents and local government units which have been a bit slower in giving out relief aid and things like that. But in general, yes, I think this would be very useful to the national government. But really, again, it should be more useful to these local government units. I mean, um, these numbers, those are the numbers. And based on their numbers, they really need to gauge how well or how poorly or maybe how lukewarmly they're doing. And if they're not doing so well based on our survey, I think they should just take it constructively and really take it as a call of action to try to do a little bit more for the people.
Right. We've seen how local governments stepped up during this COVID-19 crisis in the Philippines. And a question asks, does it make sense to also conduct a survey on best practices? Because the center said that it gives attention, it needs to be given attention given the challenges amidst the pandemic. So I think we've seen on media how Valenzuela City has been adopting certain measures implemented by Pasig City, and you mentioned that earlier. So should there also be a survey or a separate discussion on the best practices conducted by these local chief executives?
Well, definitely agree ako sa kopyahan nila Mayor Rex Gatchalian at Mayor Vico Soto. And I think all of the mayors should be copying all the best practices of each others. And actually, PUBLiCUS is in the process of coming up with a sort of cheat sheet for them, or a best case practices manual for LGUs in responding to COVID-19. We're still working on this and compiling the data, but we're looking very closely at all of the policies and programs that the local government units are applying, not just in Metro Manila, but also in surrounding parts of Luzon and maybe even in other parts of the Philippines, which have been hit hard by COVID-19. And we will make this available when we can. And again, I think personally, I see no problem with the healthy competition between these high-performing mayors in Metro Manila, like Mayor Rex, Mayor Vico, Mayor Teodoro, Marikina, Mayor Isko, of course, Manila. And, I think the other mayors should, I hope each and every single mayor of Metro Manila will join in the competition and, try to raise their game, because ultimately that healthy spirit of competition will benefit all of the constituents of Metro Manila, regardless of where they live.
Okay. Question reads, do you think that this COVID pandemic would change the landscape of Philippine politics and those government frontliners? Would it change Philippine politics in perspective?
Well, I think yes. This is the COVID-19 is going to change the world as we know it. I think, and it already has, and it will continue to do so. But I think specifically when it comes to frontliners, uh, I think we've already seen enough to show that we really need to invest more in these frontline health workers, these doctors, nurses, the medical technicians, all of these people who have played such an invaluable role in fighting this pandemic. And that could be a whole range of things. It could be salary, benefits, uh, also, I think maybe scholarships to train more of these individuals, because I mean, we've been talking about the brain drain for more than a decade now, and one of the sectors most hardest hit by the brain drain is the public is the health is our health sector. I mean, with all of our nurses going abroad and stuff. Uh, so I think definitely these frontliners will. I hope, I pray that the government will take better care of them in the future. And more than that, I think this shows more than ever that we really need to implement universal healthcare. Uh, I mean, of course, the Philippines has already been on the right track. That law was approved in 2000. That we have the universal healthcare law. But having the law and having universal healthcare are two very different things. I mean, there's more than half a decade of lead time in completely implementing universal healthcare according to the grace period provided in the law. But that does not meet. And I think that this shows that when this is all over, all of the money that we put in health, we shouldn't take it out and put it in other places again. We need to really invest in public health in the Philippines moving forward, because I mean, we don't know what the next COVID-19, we don't know what the next pandemic will be and how hard it will hit the Philippines.
Relating to that question, the DOH is tasked with this gargantuan, um, challenge to really address the COVID-19 in the Philippines. Um, Based on the survey, does the approval rating of the DOH fairly represent what the department is doing to address the virus, from its assistance to medical frontliners, as you mentioned, and its reporting to the public?
Personally, um, I think that the Department of Health, this approval rating, I think, will definitely be on the rise, and I think certainly the Department of Health got off to a bit of a rocky start uh, in the early part of the pandemic, but I think things are quite moving well. Significantly, I think the main issue that really affected the Department of Health, or the public perception of the Department of Health, was the lack of mass testing. And as we can see in our survey results, around 94, 95% of Metro Manila residents approve of mass testing, and yet the Department of Health was initially against this. However, the Department of Health is now wholeheartedly, I think it listened to the people, it listened to the feedback, and it made a responsive decision, which was to start laying the groundwork um, for mass testing. And thanks to that, we have several stage 5 hospitals now, or stage 5 labs, according to the Department of Health. According to the Department of Health announcements, where we can, test COVID cases. We could start running thousands of COVID tests per day, so that when we get to mass testing in April 14, we can really make the most of the 2-week extension of the ECQ, and really find all of our suspected or sleeping COVID-19 cases, isolate them, give them treatment, so that we can start in the process of moving things back towards normalcy a bit. So the Department of Health isn't perfect. There have definitely been missteps, but I think that their trend is significantly improving, and I expect this approval rating to actually increase as in our next surveys.
Well said and well answered, Mr. Sinsuat. At this juncture, we thank everyone who sent in their questions, and we do apologize if we have left some submissions unanswered. However, that would be all our time for today. Again, we thank everyone who attended this virtual presser. To be updated with our reports and releases such as this, to follow us on Facebook and Twitter at our handle, PUBLiCUS Asia. To visit our website at www.publicusasia.com. And thank you, and keep safe, everyone. That ends our virtual presser for today. Have a good day.